When you think about RTLS technology, it really is about being able to marry location and events together. So from a caregiver perspective, it's not really about tracking a caregiver. It's more about understanding where that caregiver is, again, in the context of the patient and or the time that's being spent with a patient. So being able to put badges on staff allows their healthcare facilities to understand that they are spending time with their patients. It allows patients and family members to understand that nurses are spending time seeing their care, they're making sure that their loved ones are getting the care that they need. There are a number of use cases for RTLS that go beyond equipment tracking and or equipment management, and those include things like patient flow, so understanding how a patient is making their way through a facility and where they're spending time in terms of either appointments and or through a potential diagnostic process. There's staff workflow and capacity, so understanding how your staff is being leveraged in either a day and or in a department, and understanding the ability to maximize utilization of particular staff members. Hand hygiene is another example of a use case. So not just understanding that a caregiver has walked up to a dispenser, but understanding that there's actually been a dispense event associated with that caregiver, so that you can tie the fact that a caregiver has walked up to a dispenser and that a dispense has actually happened in association with that caregiver. So we like to think about RTLS more in the context of connected intelligence. So being able to take disparate pieces of information that relate to either location, event, and tying those not just to people and or equipment, but then being able to provide that information through third-party software that may have other pieces of data points coming in together, so that that Internet of Things really is delivering more information that allows healthcare to optimize its efficiencies and deliver better care to patients. You know, I think that healthcare is continuing to look for new technologies to help deliver better care at the end of the day. It's all about being able to give patients better care and allowing caregivers to spend more time with their patients. So any technology, any innovation that helps eliminate either inefficiencies or wasted processes in the context of delivering better care is really important. And at the end of the day, I believe what we do is accelerate the ability for the right information to get to the right caregiver so that the best care can be given to a patient.